it has been shown that women or children that have an excessive level of stress and even obesity in childhood has been linked to early menarche or early onset of your first cycle. And children who have experienced just a lot of childhood stressors, family dysfunction, a lot of that has been linked to menarche. But when you early menarche or early onset of your period. I don't want to use try not to use too many medical terms. I don't want to confuse or lose anybody. But when you have an early onset of your menstrual cycle as well, too, that has been linked to increased cardiovascular disease later on in life.
So attend. So this evening we have our special guest. Our special guest this evening is Dr. Naa'irah Muhammad. I'll read you a brief excerpt from her bio. Born and raised in the Nation of Islam, Dr. Muhammad became a registered member at the age of 16. Since 2013, she has been honored to serve on the Student National Secretary's sub-executive team. She earned her undergraduate degree in biology from Lemoyne Owen College in Memphis, Tennessee, graduating at just 18 years of age. She then pursued her medical degree with honors at the Latin American School of Medicine in Havana, Cuba. Dr. Naa'irah Muhammad is a rising cardiology fellow at the University of Texas Health San Antonio and is currently completing her internal medicine residency at Henry Ford Hospital in Detroit, Michigan. Passionate about preventive cardiology and holistic healthcare, Dr. Muhammad has spoken at numerous workshop panels, radio programs, and national and international conferences advocating for healthy lifestyles and improved health awareness. As a bilingual physician, she is committed to increasing diversity in medicine, serving medically underserved communities, and eliminating the health disparities that disproportionately affect Black and Latino populations. So I present to you our special guest for this evening. But before we go further into our program, I must bring up our host. Welcome, brother.
Warm welcome to you and to all who are in the listening audience. We have arrived at that great hour once again, Thursday evening GMT, where we will be plumbing the depths of some more of the ailments that we suffer and how we can prevent such and come out to be the type of people we used to be, not worried about ill health in our young age. And we've just reached a point now where as young people, when I say young, I mean very young, teenagers, early 20s, are suffering with diseases that really were reserved for their grandparents. Okay. And we have to take a look at this and see what we can do to reverse this and to stop this from becoming a trend, where we normalize that which once was alien to us. So without furthering, before I bring up my sister, I want to encourage each and every one of you already online, please send a text, please put in a phone call, please share the information with someone before we start getting into our discussion, because you will think of a few people you're going to wish you had contacted and taken the time out, because if, your friends and family can hear firsthand how we can tackle some of these challenges, then it's better than you having to try to repeat it after we're done, right? So save yourself some work and sit them before our expert. So with that said, spiritual injection, please take your devices off of mute and let's receive Dr. Naa'irah Muhammad. Warm welcome to the spiritual injection, Dr. Naa'irah.
Welcome, Dr. Naa'irah.
Welcome, Dr. Naa'irah.
Welcome, Dr. Naa'irah.
Welcome. Thank you.
Welcome.
Thank you. Assalamu alaikum and greetings to everyone that is listening right now. am very honored to be able to present on spiritual injection today and just have a conversation, answer any questions, and bring awareness. For me, as you could hear in my bio, heart disease or cardiovascular disease is one of my passions. I am completing my internal medicine training at Henry Ford in Detroit, and I actually will be going in to pursue cardiology training, my cardiology fellowship, just in July, actually, in the University of Texas, San Antonio. So for me, heart disease has always been a passion of mine. It is the number one killer, not only in the United States, but globally. And so, although I will be focusing on the women's risk factors for heart disease, there will still be some pearls for everyone that is listening. And we all know women in our family. So this is something that I think could be beneficial for everyone that is listening today. So I can actually start with sharing my screen. I do have a presentation I can start off with, and then I'm fine if you want to interrupt me throughout, or we can finish up with like a Q&A, however you want to do it. Brother Abdul Hakim, you'd let me know, but I will go ahead and share my screen if that's okay.
Please. Thank you.
Okay, so can you see my slides okay?
We can.
Okay, perfect. So I am going to try not to make it very long-winded. I did a presentation because I don't want to ramble too much and try to keep it as focused as possible. But there were just some particular pearls and things I wanted to make sure I highlighted, and especially with such a large platform, it's an amazing opportunity just to build awareness, because I think that is one of the main things that we are lacking just in general throughout our communities, is just the health literacy side of it and just a better understanding of heart disease, what it is, how it presents, and how we can help better improve our risk. So today, particularly, I put the title of Women's Hearts and Minds, and how our mental health kind of causes more cardiovascular disease manifestations in women in particular. But I will be talking about other preventive measures as well throughout the talk. So just a brief outline of some things I want to talk about. Like I already mentioned, just importance of the topic. What exactly is cardiovascular disease? Because some people may understand and other people may be like, what exactly is that big word she's using? So just to make sure we understand what that actually means, what are some of the unique risk factors for heart disease in women in particular? And what are some of the symptoms of a heart attack? What are some of those common symptoms and signs that we need to know to look out for, whether it's us, whether it's a family member? And what are some of those atypical or not so common signs that women actually present with, because women can present different sometimes than men for heart disease? And then talking about the overlap of mental health and heart disease. And then just the overall prevention and self-care measures that we can try to implement in our everyday lives to improve our cardiovascular outcomes. So I started by putting an interesting case here because I think that kind of just builds a little bit of awareness about the topic at hand and some of the uncommon signs that women present with for heart attacks, but also just some of the discrimination in healthcare and in medicine that we experience, and how it's so important to have to advocate for yourself, or to even have family members that help to advocate for us. So this is a particular patient. She was a 59-year-old Black woman. She presented to the emergency department experiencing, she said, the worst headache of her life. She was having left shoulder pain. It was radiating to her back. And she was also having some nausea and some dizziness. She didn't smoke. She had a healthy diet. She engaged in regular exercise. She wasn't overweight or obese. She didn't have diabetes, high cholesterol, but she did have a family history of high blood pressure and heart disease. So initially when she came in, they didn't really do much for her. They gave her some medication for her nausea, gave her some Tylenol, and they were, said, you'll be okay. They kind of brushed it off. But she actually presented to the emergency department with her brother. And her brother was like, no, my sister is not her normal self. Something is wrong. So he pushed the physician to get a CAT scan of her head. And the CAT scan was normal, but they didn't get any labs. They didn't do any workup for any heart disease. And so after more advocacy by her family members, and she actually had a brother who was in medicine. So they called the brother on the phone to kind of advocate for her. And ultimately they did a cardiac workup and showed that she was actually having a heart attack. And so as we can see that ultimately she did end up getting treatment. She was able to go and get a stent placed. But as we can see, one, she didn't necessarily present like everybody presents. She wasn't complaining of that crushing chest pain that sometimes people talk about. But also, if it wasn't for her having that advocacy and somebody to speak up for her, she may have had an undiagnosed heart attack. And so just builds awareness to, one, the different presentation and how we should be aware of the signs and symptoms that they can present, and understand that we shouldn't really diminish our symptoms, and know that unfortunately there is still a lot of discrimination and biases in healthcare. So we have to be our own advocates. And so I just put a couple of things here. So why is this topic important? One, I already talked about, heart disease is the number one cause of death and disease globally, not only in the United States, but this is something that they have seen globally. And in particular, it is still the number one cause of death in women in the United States. And as I already showed you, women can have different manifestations of heart disease with unique risk factors. And some of the things that gives women that unique presentation or increases our risk is some of our unique psychosocial stressors in our community, and also some of our hormonal changes that we endure throughout our lives that can impact our heart disease risk. And I think overall, a lot of times people look at heart attacks and heart disease as a man disease. Sometimes there's just an underestimation overall of the risk of heart disease in women, which is why I think sometimes there's a lot of diminishing of symptoms for women and a lot of delayed and misdiagnosis. So unfortunately, that is what we're seeing in healthcare, that women are either being misdiagnosed for heart attacks, or there's a delay in diagnosis, which also means that there's ultimately a delay in their treatment. And then even, the interesting thing is that when we have suboptimal cardiovascular health prior to pregnancy, or you see pregestational, that ultimately leads to worse outcomes for our children. So that is also why this topic is of the utmost importance. And even understanding that a lot of times when we talk about heart disease, it oftentimes is due to blockages in our arteries, but for women, we see a lot of presentations of heart disease that is not related to blockages of cholesterol and buildup in our arteries. And it is the underlying cause of it is intense stress levels. So these are some of the reasons why this topic brings importance. And even now in medicine, there are studies to now target stress in women as a way to improve cardiovascular outcomes and reduce heart disease in women by targeting actually their stress levels. And so just for, a visual, people hear me saying cardiovascular system. So just everybody's on the same page. Our body is made up of different systems that work together for our body to function. So the cardiovascular system is made up of our heart, our blood vessels, and blood. And it all works together for one common goal, and that is for the heart to deliver 4 to 6 liters of blood throughout our body with oxygen, nutrients, and then for it to return those waste products, carbon dioxide, get rid of it through our lungs, through our kidneys, through our bowels. And so our heart has a really big function. And so if our cardiovascular system is not functioning well, if we cannot deliver the oxygen and nutrients to every other part of our body, like our brain, our lungs, our kidneys, then our body is in trouble. And we are ultimately kind of doing away with one of the vital systems in our body. However, some will argue that that the brain is more important than the heart, or the lungs is more important. But for me, I'm kind of biased. So I say the cardiovascular system is one of the most important organ systems in our body. And so what is heart disease? So when we talk about cardiovascular or heart disease, I will use those words interchangeably throughout. So these are any diseases that affect the heart or the blood vessels. And this can be due to a number of disorders, but a lot of times you'll hear the term atherosclerosis. So this refers to a buildup of plaque in our arteries that causes narrowing and restriction of the blood flow. And there are different types of cardiovascular disease. So you'll hear heart attacks, and that is when we have disease of the coronary arteries, or the arteries that actually supply the heart muscle itself. Cerebrovascular disease or stroke. So those are the blood vessels that supply our brain. Heart failure, peripheral artery disease, which are just other arteries throughout our body. And the most common is coronary artery disease, which are the heart attacks or the blood vessels that supply our heart. And so here's just a visual of what atherosclerosis looks like when we have narrowing and buildup in our arteries, and how it limits the blood flow throughout our body. And then here, so I talked about how in women, there are unique presentations because not all heart disease in women presents due to a buildup of plaque in our arteries or atherosclerosis. Because of intense stress, there are different things that you hear. You may hear what they call a broken heart syndrome. There's another medical term for it, Takotsubo, but it is actually when the body is under intense stress, and it's actually been shown to be due to a surge of adrenaline in our body that causes a weakening of the heart muscle. And then ultimately, you have a transient heart failure. Most women are able to improve, but sometimes you may just still have subsequent symptoms of heart failure. But this is not due to any blockage of the arteries, but this is due to an intense emotional stressor that causes our heart to dysfunction. And then you also have this middle picture is when you have what you call a dissection, or when there's a tear in the artery. This is also something that is due to blood vessel dysfunction in a setting of intense inflammation and high stress levels. And that has nothing to do with buildup of plaque in our arteries, but a lot of times this is due to just intense psychosocial stressors and how our bodies, particularly women, our bodies respond to intense stress levels. And so we can have these other manifestations of heart disease that don't have to do with high cholesterol or buildup in the arteries. And so I talked about women having unique risk factors, but there are also just traditional risk factors, and women and men have traditional risk factors. So like I said, even though I'm focusing on women, the cardiovascular risk, there's still things and pearls throughout for everyone that is listening. And even though women have unique risk factors, common things are still common. So the traditional risk factors are still common. So hypertension, obesity and being overweight, diabetes or high blood sugar, which leads to a chronic state of inflammation in the body, increases your risk of heart disease, high cholesterol, poor diet, of course, toxic habits like alcohol, smoking, sedentary lifestyles, and mental stress. These are considered our traditional risk factors that affect both men and women. But when we think about some of the unique risk factors in women, we have to think about some of the different reproductive milestones that women actually go through that contribute to our psychosocial stress levels. So when we think about menarche is the age of onset of the woman's first period. So that is called menarche. And in particular, it has been shown that women or children that have an excessive level of stress and even obesity in childhood has been linked to early menarche or early onset of your first cycle. And children who have experienced just a lot of childhood stressors, family dysfunction, a lot of that has been linked to menarche. But when you early menarche or early onset of your period. I don't want to use try not to use too many medical terms. I don't want to confuse or lose anybody. But when you have an early onset of your menstrual cycle as well, too, that has been linked to increased cardiovascular disease later on in life. And then additionally, when we think about pregnancy in itself is a very stressful time for the woman, and the woman's body is under a lot of biological stress. And from that, women also deal with a lot of social stressors, which can lead to poor cardiovascular outcomes afterwards. And in women who have a lot of stress around pregnancy, they also have more pregnancy-related complications. So even in combination with, cardiovascular and a lot of primary care doctors, cardiology doctors, working together with a lot of OBGYNs, because targeting stress can really help improve some of the pregnancy complications that are arising in women. And then, of course, menopause in itself is another milestone in women's lives that cause a lot of psychological stress, a lot of social stressors, because their body is going through so many changes. And this has also been linked to increased cardiovascular disease because of the stress levels related to these different reproductive changes. And then in general, I thought it was interesting because in my research, just looking at how women have a unique propensity towards cardiovascular consequences of psychosocial stress. So it was shown that, I'll talk about it a little more later, but when you think about the fight or flight response, or our sympathetic nervous system, where you hear about stress hormones like adrenaline and cortisol, women tend to be more sensitive to high levels of these stress hormones. And ultimately they have consequences on our heart and our cardiovascular outcomes, which is why now a lot of focus is trying to be put on targeting stress in women to improve heart disease outcomes because of how our body is so sensitive to that and causes such higher levels of inflammation and our artery dysfunction, leading for us to have more cardiovascular disease. And then even the distinctive burden of just psychosocial adversities that we deal with. Women are more likely to have a higher prevalence of PTSD, depression, anxiety, mood disorders, childhood adversity, and even marital stress and caregiver stress. You know, majority of women, I believe it's over 80% of women, are actually caregivers. So all of these contribute to our stress levels and ultimately weigh on our hearts and causing us to have higher levels in incidence of heart disease because of our stress levels. And then, of course, it probably goes without saying, just the impact of race and ethnicity. So Black women, Latin American women, just the levels of discrimination that we go through, the segregation, the financial strains and burdens, and even if you are an immigrant, having lack of access to resources, how all these unique factors have been shown to increase cardiovascular disease. And then autoimmune disorders, as we may have seen, some of us may have not, but autoimmune disorders like lupus, rheumatoid arthritis, these different diseases tend to be more common in women. And a lot of times too are linked to excess stress levels and high stress hormones in our body that lead to us also having these autoimmune disorders, which ultimately lead to us having more heart disease because these autoimmune disorders lead to more inflammation in our bodies. And so this is just a quick picture of what I kind of already talked about and some of the different things that come together to cause these psychosocial stressors in women. So in addition to our reproductive milestones that we go through, but the different our domestic situations, our marital situations, and how a lot of times, unfortunately, us as women, we have our body responds to this different. They respond to stress hormones a lot different. Our bodies are a lot more sensitive to the adrenaline and the cortisol in our blood, causing a lot of inflammation and dysregulation. But also, unfortunately, when we're under a lot of stress, that leads to us having poor behavioral patterns. So then because you're stressed, now you're eating worse. You're less active, you're more sedentary, you're gaining weight, you're having sleep disturbances, you may pick up some toxic habits, and then you may be disengaging from some of your community or people around you because of the stress level. So all of these contribute to you having a higher risk of having heart disease. And so I wanted to briefly touch on what are symptoms of a heart attack, because I think everybody who is listening, if we may not have suffered a heart attack, I'm sure we know somebody that may have suffered a heart attack. And I think it's important that we know what are those presenting symptoms and signs of a heart attack. So then that way, even if it's not us, if it's the next person, if somebody we can make more aware so that we are not seeing such poor outcomes in our communities. So you see, I have here common symptoms and I have atypical symptoms. And we don't want to really say atypical because for example, like I mentioned, there are a lot of women who present and they say they have fatigue. They just have indigestion. They're not saying they have crushing, stabbing chest pain. So they try it in the medical world. We're trying to get out of saying atypical because we don't want to make it seem like, oh, your stuff is different from the usual, because no, it has been shown that this is something that is usual for women. But some of the common symptoms of a heart attack you'll hear is chest pain. Somebody will say they're having chest pain. You usually hear it described as stabbing, crushing, pressure-like, or somebody is squeezing them. And although, like I said, women have atypical symptoms, common things are common, regardless of how rare things you may see, or you may see something that's different. You still have to always think about the common things are still common. So women still often always present with chest pain as well too, but they may also have 3 or 4 other symptoms that may sometimes convolute or take people away from saying, oh, well, maybe this is a heart attack. And then other common symptoms, you may have jaw pain, neck pain, shoulder and arm pain, particularly the left shoulder, and even shortness of breath are all common symptoms of a heart attack and should raise alarms in our head if we're hearing those symptoms or if we're feeling these symptoms. And so, like I mentioned, some of the other symptoms that women can have: anxiety, panic attacks. They may just feel like their heart is racing. They may have nausea. They may be vomiting, excessive fatigue or indigestion, and belly pain. So sometimes, because women have some of these other symptoms, one, they deal with, they don't get cardiac workup sometimes because they don't think that this is a heart attack. It doesn't sound like a heart attack. It doesn't look like a heart attack, excuse me. But it's important to be aware of this. And even for the women listening, being aware of this, because if something feels off with your body, something feels different, even if they're not ordering something for you, if you feel like this may be, this is something that I heard about of a heart attack, let me ask them to add those orders. Let me advocate for my sister. Let me advocate for whomever that I know is having these symptoms, or let them know that these are some of the presenting signs of a heart attack. And I think that's one of the main things that I see in medicine, is that we just don't have enough awareness and education on some of the things. And unfortunately, we end up presenting way too late, and we see a lot of poor outcomes because of this, and particularly in the Black, Latino communities, and those of us who don't have access to healthcare resources. And so anybody that has heard me speak, I always talk about the biopsychosocial ideology. I am a physician trained in Havana, Cuba, under the Cuban healthcare system. And I always love to incorporate it in any of my talks, because the basis of our training in Cuba was a modelo biopsicosocial, or the biopsychosocial ideology. And I added in the spiritual, because for a lot of us who are spiritual, that also goes hand in hand with the psychological. But that means that you have to treat an individual biologically, psychologically, socially, for them to have an overall well-being. So for somebody to be healthy, we can't just say, oh, okay, you're coming in with nausea, let me just treat your nausea. We can't just say you're coming in with a headache, but it's like, okay, you have a headache. Well, what's different about this headache? What happened this morning? So those are some of the things that I'm asking when somebody comes in clinic with me, like, oh yeah, I just been having a lot of stomach pains. I've been having more headaches recently. Oh, okay, let's talk about it. What's been going on different? Oh, well, actually, as a matter of fact, I did just get laid off from my job. Or as a matter of fact, I was having these stressors with, with my husband, with my wife, with the children. So you end up hearing that there are more things that are going on that are contributing to some of our symptoms that we are feeling. So in Cuba, we are taught that you have to look at everything. And even, what does your social support look like? Who's your friend group? What does your family support look like? Do you have that additional support? All of these are things that are going to be so important when you think about us being healthy overall and our overall well-being. So I wanted to just put that tidbit in there so we can keep this in mind as we go through our day-to-day routines, as we're seeing doctors. If they're not talking about it, you talk about it. If they're not saying, asking about these other things that are going on, you bring it up. You feel empowered to actually bring up these other things that you may be dealing with, because a lot of times that has an impact on our health.
Let me just butt in a little here, Dr. Naa'irah, because and go back to that last slide.
Absolutely.
That seems to be the crisis, one of the crises that we do suffer from, right?
Mm-hmm.
Like, who do I know in the medical profession who really cares about me? Is there anybody in the medical profession who actually want to see me, well and healthy, and, willing to put aside the time to spend that extra 5-10 minutes with me to ask me the questions that you mentioned? Because most doctors, they don't talk about psycho, bio, spiritual, social. They're more like, want to just prescribe something. So how do we, because we don't have a lot of money. Obviously, if we had money, we could go and buy the best that there is out there. But for those of us who are not necessarily in the best financial condition and are subject to, just the general care that the government offers, how can we best navigate such toxic, professionals, if you will? For instance, I was with somebody today, and we were going to have some dinner, and it was a very nice place we were in. Someone just traveling to the UK, and we were just going to have a business meeting and whatnot, eat some food. And it was a very high-end place. But he said he didn't like the energy of the waitresses and the waiters. So he didn't want to eat. And I said to myself, that's great, because I didn't know he was that spiritual. But he was picking up on the energy of the waiter and the waitress. And his vibe was, let's tap out, let's get out of here. Because if those who are going to be moving our food around have a bad energy, I don't want to be in this place. So how can we be sensitive to those who we're putting our lives in their hand? How can we choose better, or how can we pull better way? How can we pull, a group who are like you?
No, that's a great question, because I think so many, and I get it all the time, because unfortunately, we do deal with that. And I think, I see both sides of it because I work with people who, and unfortunately, you have the insurance companies who are running a lot of healthcare, especially if you're in the United States and they're dealing with such short appointment times and time constraints and all of these different things. And so I think one, it's about trial and error and asking the people that you know. For me, like here in Detroit, I've met some amazing doctors who are very big on treating individuals as a whole. I work with some male doctor, like a male, black male doctor or female doctor, just, and not even just that, people, you have to find people that you relate to. I think that's important. And sometimes finding a doctor is what it's about. You may go to somebody and you realize you're talking to them, but they aren't listening. They're kind of brushing you off. And if you need to find another doctor, I think that that's something you should do because our health is so important. And one, as Black people, we have better outcomes when we have doctors that look like us, one.
Right.
And that is for a lot of different cultures and communities. And I noticed that too, because I'm at a hospital where there are different cultures that come in, and the blessing, I'm able to see some of the Latino patients, but you just see the difference in talking to someone. You can speak their language when you understand some of the culture. Like there's another level of connection that comes from that. And so I think one, it's about trial and error. So if you find somebody that's not really listening to you, I think that's important. I think you should pay attention to that. I think if you know doctors in your area, in your state, and even sometimes here for me, like if somebody asks me if I have recommendations for doctors, I have a pool of people that I'm connected with, and we can try to connect you with somebody that we know. But I think this ideology, each of us individually knowing that. And that's why I empower people for you to bring it up. If your doctor isn't bringing it up, you bring it up. If you're also having these higher stress levels and you notice that this is something that changed. And I think sometimes there is a little bit of, it's a lot of stigma in our community too. And I also talk about it because of that, because sometimes we downplay the stress that we go through. We downplay a lot of what we're subjected to every single day. But reality is that it is affecting our health. And so I think that, unfortunately, there's not a lot of Black physicians. We are the minority there. But I think there are still other very, very great physicians that will take that time to talk to you. And like I said, I think it's just trial and error. Because even for me, I have a doctor too, and I had to try a couple times because I'm like, I'm not really feeling this connection here. I don't think we're able to have that conversation. And that's important. Even through my training in Cuba, I always bring it back to Cuba. We are taught the importance of the doctor-patient relationship. That is the very first basis of medicine and trying to treat somebody. If I don't have a connection with my patient, if they can't trust me, if they can't talk to me, if I can't have a conversation with them so they can, one, understand what's going on with their health, one, to engage in shared decision making, meaning I'm not making a decision about your health. We are making a decision together about your health. So if we are not able to have the fundamental basis of that doctor-patient relationship, then we are already starting off on a bad note. So I think finding somebody that you feel that connection with, and it may take some time because unfortunately, more of us are coming into the field, but there are still many great doctors out there. So of course, if you're looking for a doctor, if you don't have a primary care doctor, trying to reach out to somebody in your network, in your state, wherever you are, to see if they may have somebody they can refer you to as well. But trying to implement these things in our lives and understanding that even if I'm dealing with hypertension, if I'm dealing with diabetes, that I still need to be making sure that I am managing my stress levels, that I'm praying, that I'm having good social support. So even for us, and this is why I bring this up, because I want to empower us to make sure we are doing it, because even if they don't always tell you to, you should do it, because this is going to impact how your body responds and how disease manifests in our bodies.
Right, because I was going to say, as a doctor, a doctor, obviously, you're taking on people's stress every day, right? And so how do you manage your stress, and what advice would you give? What's the doctor's playbook?
That's a great question, because I talk about it all the time. It is very, very hard sometimes, when you are trying to show up and be there for your patients, and dealing with and having to listen and talk them through a lot of different things. So for me, one, I pray. Prayer is one of the bases of me keeping my mental together and just feeling at peace, going to the gym, working out, exercising. I tell people, even if the gym is not your thing, find something that you like. If it's Pilates, if it's biking, if it's, Zumba, whatever that is, getting your blood flowing, getting outside, getting vitamin D. These are things that are going to improve your stress levels, getting fresh air, and fellowshipping, having a social environment connection, whether that's your family, loved ones, people that make you feel good, people you can talk to, people that want to work out and do things together. You know what I mean? It's so funny because I think about even when we're at work, and a lot of times even doctors aren't always the healthiest. So we're at work, they want to always take the elevator, they try to not take the stairs. When you got one person who's like, no, let's take the stairs up to the 5th floor, and you're like, all right, man, we all gonna take the stairs up to the 5th floor, so it's like having those social networks too. So like vying with one another in good works and things that we can kind of help feed off of each other to improve our lifestyle. And then for me also, I'm in therapy. I am in therapy. I am an advocate of therapy, auditing, and just having an outlet for whatever day-to-day stressors you may have, whatever traumas, whatever that is that you may be dealing with. And I think as a community, especially in the Black community, we have a lot of things that we've been dealing with that we are, where our body are in chronic inflammatory states because we have cortisol and adrenaline in our body, just because we've been holding on to so much stress and trauma that may have started from childhood. So I think it's important addressing that as well too. So I also recommend finding a way to have that outlet. If you like journaling, if you like sitting and meditating, and just mindfulness, relaxation, I think all of those are good ways to manage your stress levels. And if you need a good venting session, like you need to talk to somebody and just vent about your day and somebody who understands, do that. If you need to just
did you say venting or a cussing session? Did you say venting?
I said venting. I would not be on the record to say there was any cussing involved. However, whatever works for people.
I was watching a program where they have these environments where people go and just smash things up, get a baseball bat.
You know what? I saw that and I was like, maybe I might try that one day. I don't know. I think having, like I said, whatever that outlet is, if you need to call somebody and vent, that one person that lets you talk and y'all can, just let it out. I think all of those are good ways to start managing your stress level.
And martial arts and
all of that.
Maybe some boxing, hurt somebody every now and then.
Exactly.
In an organized way.
Exactly. Yes, absolutely.
Fantastic. So it must be a breath of fresh air for, your patients to come in and see such a young, vibrant sister. Do you think just the fact that you're young and you've been blessed to achieve this, just you being there also can relax your patients and raise their, what's the word for it? Their spirit?
Yes. I have had feedback about that, and you probably wouldn't be surprised, but so many times I walk into a room because they see Dr. Muhammad sometimes, and I'm in a place where there are a lot of men, Middle Easterners, that have Muhammad as their first name. So one, they see me walk into the room, they're like, "Oh, I was expecting a man," and then they also say, "Oh, I was expecting somebody older or old. You look so young," and I'm like, "Okay." I can get the older doctor if you want, I'm fine with that. And they're like, no, we're like, but I have, it's so interesting. I have had patients, I had one particular, it was a Black male patient, and he was coming in, he had missed some appointments for a while ago. He actually was dealing with some heart failure that he had. He was having issues with his medication. And we just sat and talked about, because I asked myself, okay, so the last time you was here, maybe about a year ago, tell me what's been going on. Have you took your medications? And he just talked to me. He said, honestly, it's just, it's just been hard. I've been dealing with X, Y, and Z. And we sat there and talked for maybe about 10 minutes. And afterwards, he said, wow, like I almost feel like I was in a therapy session. Like this was one of the best doctor's appointments I've ever had. And I'm like, if this is, so I get such good feedback. I have younger patients that come in and you can tell that they're kind of refreshed, they're laughing, they feel like they can relate to me sometimes. And actually that patient ended up coming back for his next appointment in like 2 months, because the one that I had that wasn't there for years, the same one that I spoke to who felt so good after that appointment, he ended up coming back, and we're able to actually follow up on the things that are going on to actually get him in better health. So I do get, one, they like seeing a Black face. They love seeing a Black face because they feel like, oh, I can. And you see them kind of, you actually see them like exhale. You see them go, oh, like, you know, like, oh, it's like it's a Black doctor, you know.
Yeah.
And it's like, yeah, what's up? Let's talk, you know. And so I do think I get a lot of good feedback from patients, and seeing a young doctor, I think that makes them feel better, and just someone that they feel they can relate to and that listens to them. I think it makes such a huge impact. And then it also increases their chances of even coming back to even want to follow up and stay connected. So they're not being what we call lost to follow up. So now, you know, they have uncontrolled diabetes, but now they're never coming back because they had such a poor experience. Like the brother you went to with that at the restaurant, like, no, I ain't coming back here. I ain't like the waiter. Why would I come back to this place? You know, but when you have a good experience and somebody that talks to you and listens to you, doesn't make you feel uncomfortable, doesn't make you feel like you're judging you, then that puts you in a better predicament for that doctor-patient relationship and for that better follow-up and care.
So do you think, regardless to the distance of such a person, that once you find that person, even if they're an hour away from home, so some of us are saddled with certain doctors who are not the best, but because their office is just around the corner. They're close, they're in close proximity. And is that a part of the problem? A bit of laziness there. You know, I'll take what is first and what is convenient, as opposed to putting in the work and searching for the best that you can find, because this is your life, right? You only get one opportunity to do this. So do you think that kind of mindset needs to shift also? You know, where can I go and get the best person for me needs to be, because sometimes, for instance, if you're being referred to a specialist, you know, the general practitioner will always generally say, do some research. Here's 3 or 4 names. Okay. Now, if you're lazy, you just ask the person, what would you recommend? As opposed to doing the research yourself and taking responsibility for your life. How important is it for us to take responsibility and do the research?
Very, very, very important. I think so. So I've seen different scenarios, especially at the hospital that I work at. I actually work with another doctor who has been in practice for maybe about 20 years or so. And he has patients that travel very long distances to come see him. Like, they've seen him for years. They refuse to go anywhere else. And they're like, no, this is my doctor. He treats me well. He listens to me. I know I have a connection. But I will say, I see the other side of it too, where you have patients who have to come to the doctor's appointment on foot because they don't have transportation, or you have people who are dependent on public transportation system to get them there. So I understand those situations as well too, where you do feel like you're limited because of your financial resources or your lack of transportation. But I do think it is very important to research the doctors that you're going to. If you know somebody, I think it's good to ask a doctor, like, hey, who would you refer me to? You know, one of the best questions that I got from patients is, okay, would you send your family member to that person? You know, would you go to that person? Right. And so when they ask you that, it makes it a little more personal, because then you're like, oh, well, and then you see how they respond to that, because if they're looking like, I don't know, then you know that maybe this isn't the best recommendation. But then if you know, to say, no, I would absolutely send my sister, my mother, my father to this particular doctor for this intervention, then you know that this is somebody good that you can work with. I think that definitely research and asking people that you know. There's also a lot of things online too. Like, if you type in some of these doctors, there's a lot of reviews that you can read as well. But I think that sometimes there may be limited information sometimes. So I think asking doctors who they recommend is a good start. Asking who would they recommend their family to go to, who would they go to, and looking online, or if you know people that have had certain illnesses or diseases, and if they've been to a specialist, asking them who they went to, and just getting some collateral information, I think is helpful as well too. But I think that if you have a good doctor and you have to travel for them, I think you should, because I think good doctors I think they are hard to come by. There are a lot of good doctors. I do believe there are a lot of good doctors, but I do believe that it takes time and to find the one that you like. I do know that we, especially Black doctors, are the minority. So I think if you find somebody that you like, traveling that distance. I mean, I don't think you'll be going there every month, hopefully. So I think if you got to go there once every 3 months, once every 6 months, it may take you doing that extra, taking that extra step, that extra drive to see that person that you know will treat you fairly, that will listen to you and give you that overall care that you need for your health.
Yes, ma'am. We can proceed with this wonderful PowerPoint presentation.
Okay. Yes, sir. So I wanted to just talk about some of the psychosocial factors and how it plays a role in heart disease. And it looks like a busy picture, but I'm just going to simplify it down for you. But essentially how our body responds to stress. You may have heard of a sympathetic nervous system, or you may have heard of your fight or flight response, your rest and digest response. And so our body and the brain, we have what we call a hypothalamus, a pituitary gland that secrete hormones. And when they sense a danger, when they sense that there's an outside stressor, that sends a signal to our adrenal glands sitting on top of our kidneys to secrete adrenaline and cortisol. And when these are secreted, this, stress in the acute setting is good. Those hormones were created to help us. So if you're at a zoo and the lion gets out, these hormones coming out are going to help you because it's going to cause your heart rate to go up a bit. It's going to cause your pupils to dilate. You're going to start doing things you didn't know you can do, running faster than you ever could, probably, to save your life. But when your body is exposed to these stress hormones for a prolonged period of time, this leads to increased inflammation in your body because it secretes inflammatory markers in our body. And these cause blood vessel dysfunction. It causes dysfunction in our clotting factors in our blood, causing us to be more prone to blood clots. Our blood vessels are constricted for longer periods of time, which leads to high blood pressure, increased heart rates, and this can ultimately lead to heart failure, heart attacks. Increased inflammation causes diabetes. So there's a lot of downsides when our body is being subject to stress over a long period of time. And so I want to just first talk about, we kind of touched on some of this a little bit, and just overall prevention strategies for heart disease are going to be some of the main lifestyle things that we can do. So when we talk about healthy diets and nutrition, it's going to be one of the main things you can do. So diets high in vegetables, fruits, fibers, low in red meat, fatty, fried foods, all of those are going to be good. Fasting, those are all going to be good things to do for our diet and nutrition. I'm going to just kind of go through these pretty quickly. Regular physical activity. There are recommended numbers of minutes that we should be doing a week. But I think for anybody, especially if you're living a more sedentary lifestyle, doing more than you were doing before is going to be a great first start. So if you have a desk job, and like I even mentioned at work, sometimes when we're walking through the hospital, sometimes you may be tempted to just take the elevator up to the third floor, the fourth floor, but no, taking the steps sometimes, or if you have a smartwatch, looking at the amount of steps that you're getting in and challenging yourself to do more than you were doing before. And then if you have high blood pressure, hypertension, if you have diabetes, high cholesterol, making all of those other traditional risk factors can help improve and prevent heart disease or another recurrent episode of heart disease if you already have heart disease. And then, of course, avoiding toxic habits like smoking, alcohol. And then I'm going to just talk more about the stress management and mental well-being, which we kind of talked about already just now. I mentioned a few things that I like to incorporate, but I think overall in general, especially in women, but also for men too, these are going to be ways to approach our psychosocial stressors to improve our outcomes, because like I already showed, the effects of the stress hormones in our body over a long period of time are really detrimental to our heart and lead to heart attacks, to heart failure, high blood pressure. So if we can start at the fundamental basis by approaching some of our stress levels with prayer, like I mentioned, or if that is something that's important to you, if you're a spiritual, incorporating prayer into your day-to-day routine. As we are taught, when you read the Holy Quran, we believe that prayer and the remembrance of God is the greatest force. So if we are dealing with certain things in our life, incorporating prayer into that to help us deal with some of those stressors. Our sleep hygiene, I think we underestimate the importance of getting quality sleep at night. And women, especially when you're postmenopausal, we are more subject to, and even in pregnancy, postpartum, we're really subject to a lot of sleep disturbances, and we struggle with insomnia. And when you have poor sleep quality, that ultimately leads to you having poor lifestyle habits and more stress. Your brain isn't able to function as well. Your body and immune system is not functioning well. You're not thinking straight. You may start doing more detrimental lifestyle habits when you're not having the appropriate amount of sleep. So even good sleep hygiene, I think, is underestimated in improving our stress levels. And then, like I mentioned, relaxation, meditation, and even just mindfulness overall, whether that's you being outside, if you like yoga, having that time to yourself with the white noise, whatever that is, I think those are good ways to combat your stress levels and have a moment to yourself and just to recenter yourself. And even creative hobbies, getting another part of our brain functioning and working, doing something different you never did before, doing something that you can do with other people. If you want to start painting, if you want to start doing just a new thing, yoga, Zoom, you run outside, anything, something new or something just to get your mind flowing. If you like doing different puzzles, all of these things are good to help relieve your stress levels. And then I mentioned the importance of just a social network, that biopsychosocial, that part is so important. So whether that social network for you is a religious community, if it's a community organization, if it's a sports group, having that social support is very important. And we actually see worse outcomes in patients that don't have social support. Unfortunately, even when you think about patients that need transplants, a lot of times they unfortunately don't give transplants to people who don't have good social support systems because they have worse outcomes when you don't have good social support. So having, like I said, whether it's family, just finding a group. For me, I'm in a book club. I love my book club. It's a nice way that I decompress and things that I do outside of work. So whatever that is for you, I think that's something very important. In therapy and auditing, I kind of alluded to that earlier as well, too, that I highly recommend it, because we're not addressing some of the traumas and the stresses that have been in our life, whether they're new or old. This increases the amount of stress hormones that are just in our bodies, constantly secreting. And we have, like I said, that constant exposure to them. It is worse on our heart, and it puts more strain and stress on our heart and leads to earlier heart disease. And so just some like takeaway points. We kind of talked about a lot of this, but I think one, getting regular checkups can help you, stay ahead of your heart disease. I think if, like I mentioned, having awareness of some of the things that contribute to our heart disease risk, even if they don't ask you about it, you bring it up. For women who have had pregnancy complications, that increases your risk of heart disease in the future. Bring that up if they don't ask about it. If you have stress, depression, anxiety, bring those things up, even if they don't ask about it, because all of this contributes to your heart disease risk, and you having an earlier onset if it's not addressed earlier on, as soon as we identify it. And then recognize the warning signs of heart disease. I hope that at least today I brought up some brought awareness to the warning signs of heart disease and heart attack, so that we are able to stay educated and educate those around us. It's not only about us educating ourselves individually, but also our communities. We have a bigger task at hand, that our communities are suffering from heart disease. So it's not just us, it's people that we know, it's our friends, families, their fathers, their uncles, their mothers, their aunts. So we have to make sure we're not only holding on to this information, but share it with the next person who may not have been able to get on this platform, or as a reminder to those others about some of the risks for heart disease and how we can improve our risk. And then just overall, remembering the biopsychosocial and how we have to really tend to all of these things. So not only eating good, we're praying, we're having that social support, and we are doing our auditing, our therapy, whatever that is, creative hobbies, to really bring about that overall well-being of our health. So hopefully I shared some things that we were able to take home and take away. I will stop sharing my slides and open it up to any additional questions that you may have.
Fantastic. First question I want to ask you is, how many of us do you think are suffering from psychosomatics, where the way how we think actually is the trigger point for ill health?
Almost all of us. I would say almost all of us. I think there are so many of us. I don't think that there is, unless you are doing certain things that incorporate some of these habits already, especially a lot of Black patients that I see, almost all of them have something that they are dealing with. but they are not necessarily addressing, or that I notice is causing some of their symptoms that are going on. So I think a large portion of us have some psychosocial stressors that are contributing to our health. And it may not be heart disease. Some people manifest in other ways. So it may be autoimmune disease in certain women. It may be irritable bowel syndrome in certain people. So it manifests in different ways. It's not just heart disease, but your mental stress can cause disease on different levels in our body. And so I think a lot of us do. Now, are some of us managing it very well where it may not be? Yes, I will say that. I do think some of us are probably incorporating those necessary things in our day-to-day routines and our day-to-day lives to improve how that stress is showing up and manifesting in our body. But I do think we all deal with it. I do think it's underestimated, though. We underestimate our stress risk, and it leads to adaptive behaviors because we don't really put enough emphasis on the stress that we are dealing with.
Okay, so you studied in Cuba, and now you're practicing in the quote unquote wealthiest country on the planet that has access to, has a large budget in this field of medicine. Are people pound for pound more healthier and live longer in Cuba or in the US?
In Cuba.
Right.
Sorry.
Go
ahead.
I was going to say, so Cuba being so much poorer than the United States of America, but people are healthier and live longer. Have you been somewhat tempted to go and practice over there more so than where you are?
What I will say is I love Cuba. It's a beautiful country. I met some amazing people in Cuba. I will say it is a developing country. So there are things that you don't have access to certain amenities that you have here. And I think overall, when I went to Cuba I went there on a scholarship by Fidel Castro, who started the Latin American School of Medicine back in the early, I think 2003 maybe, or 2000. And it was for the ultimate goal to give students scholarships, full scholarships to study medicine in Cuba. But he wanted us to ultimately go back to our medically underserved communities in our home countries. He made the quote that he said he understands that there are third world communities and first world countries. And so he wanted us to get that training and soak up that knowledge to come back and practice here. And, ultimately, I do think, I think it was a great time I had there, but I see the need. I see the need here. And so I think it's of the utmost importance that more of us are coming into the field so that we do have that option to find a doctor that we can relate to. So we do have more access to healthcare. So we don't feel like that we aren't accepted or welcome in our healthcare system. Because unfortunately, that is what it feels like, a lot of times, because even for myself as a patient, I understand that side of it too. As a Black woman, when I go to the doctor as a patient, I understand that side. So I empathize with my patients because I get that there is sometimes that disconnect that we feel, and we feel that we don't get treated fairly. We don't have doctors and people that look like us. So I say that all to say that I think I'm in the right place. I think I'm where they need me. So for that, I'll go back and visit my Cuban fellows, but right. I think this is where I'm supposed to be.
Right. So would you say in Cuba, the reason for the higher level of health is because they make decisions, or they're better decision makers than maybe those who you're dealing with in the United States of America?
So I think there's a couple of things.
Or less access because they don't have all of this to choose from. They're very more sophisticated in the choice they make because they're not overwhelmed with Chinese excess.
Yes, I'm like, you hit the nail on the head there, because I think there are a couple of things. So one thing I learned about Cuba when I went to medical school there, they're a very educated community of people, very educated. Cuba participates in a lot of public health movements. They do a lot of health promotion in the community. A lot of times when you are in Cuba, your doctor is right there on the corner. So they have a lot of community doctors in your community. So you see your doctor every day walking down the street. they're doing health seminars every week, every so often. So they're very educated. They have access to their doctors a lot more readily available. And that's not to say that there aren't some flaws in the system. I think every system has some flaws in it. But additionally, I think what you said too, sometimes the access, we have way too much access. We have a lot of processed foods that we have access to, a lot of fast foods that we have access to. We are more in our cars and we're not walking as much. In Cuba, I walk so much. A lot of times I just have what they have at the fruit produce stand. So I'm like, well, I guess I'm making a meal out of beets and, cucumbers tonight, so it's like, so when you have to work with that, when that's what you have, or there's still, a lot of like bikers that carry you around to get to A to B. They're still on horseback. So there's a lot of different things that are so different from how things are here in this, developed country. And I remember I met so many Cubans who say, "Oh, I want to come to the States." And I was like, well, we got a lot of flaws. It's not all it's cracked up to be, It's, they have free education, free healthcare, and get certain portions of their eggs and their beans every month. So I think that all of those different things contribute to the improved health outcomes in Cuba, because they educate their community. Their community is more active. They don't have a lot of fast food, processed foods. They're just doing more physical activity than we are doing. We're just more sedentary. We're exposed to more, like I said, just genetically modified foods that are just making us sicker. Unfortunately, that's really what our system has been built to do. It's really to make us sicker. So eating a lot of these things, they want us to get diabetes. They want us to get hypertension so that way they can sell us the medication. So we also have to be mindful of those things that are working against us and make more informed and conscious decisions when we are eating and when we're trying to live healthier lifestyles. So I think, Cuba has those good things on their side when it comes to their health outcomes.
Yes, ma'am. So tell me this in regards to the symptoms that you mentioned, because I know there's some on this call who say, "Yeah, I feel those symptoms every day." It's like I was at the gym today doing a very hard class, and when you mentioned all of these, I was like, man, I'm sure I feel everything. So the point is, if somebody feels some of these or suffers some of these symptoms, what would you recommend they do? Because many people are afraid to go to hospitals nowadays. It seems as if, you have more chance or more luck, trying to, medicate yourself or then to submit to some of these characters inside these hospitals, particularly on the weekends when the big doctors are on the golf course, taking their break and hanging out with their family. So what would you recommend with that? Would you recommend that just like people paying for their mobile phone bills or paying for their car note, do you think it's important for people to invest in health insurance and actually pay for that so you get access to a better crop of people, or just play the lottery with what, the social care has to offer?
So I think, to answer your first question, I think that if you are, I'm laughing at you saying you have these symptoms sometimes just at the gym. Right. So here's the thing. I think a lot of times when we have physical symptoms, like if we're just having some chest pain because we're stressed out, but this is exactly why this is important, because if you think about it, if you are under this much stress where it's causing you physical symptoms, at a certain point in time, it's going to be a real thing. And I think that I see the other side of it, where I see the patients who were scared to come to the hospital, and now and a lot of times it's Black patients, and they're nervous to come, and ultimately they come to the hospital and it's a bit too late. And it's like now, and you hear a lot of time when you hear medical literature, they say Black people have worse outcomes or Black people have a worse prognosis. But is that also because we don't seek care early enough when we have those first signs?
Right.
And so I fully understand the hesitancy because, like I said, I get it. I understand both sides as a doctor and as a patient, as a Black female patient, I get both sides of it. But I think seeing the bad outcomes, or when I'm seeing you on full support in the ICU because you had a heart attack and didn't come in time, and now your chances of recovery are slim to none. Or maybe you just have a diabetic foot infection that you say, oh, it's going to get better on its own, but now I'm seeing you at the point where you need the amputation of that foot. So I think I would urge people to seek care. And of course, and maybe that's even trying to identify those places, because even here, for example, my hospital has a lot of remote ERs. So sometimes people already know at the main hospital, our ER is very busy all the time. But they know this particular remote ER over here, they know it's not that busy. They know you'll get seen quicker. You'll be able to just go in and get your EKG if that's what you need, or get those levels to make sure you're not having a heart attack. So also even just trying to, if you can, before it's too late, identifying those health centers in the area and actually saying, okay, what are the ones that I can maybe get to quicker, or get to that will give me the best quicker care that I need, or less, it's not as crowded as the other one over here. And I think that's what's really beneficial too, to just have a primary care doctor, because if you have a primary care doctor and somebody that you're checking in with, maybe even if it's just once a year, twice a year, then you're not forced to automatically go to the hospital when now something detrimental is happening. And maybe you will get there, but sometimes we're able to look and see, okay, we see some kidney disease here. Okay, we see some high blood pressure here. We can start catching those things early before now it's way too late. And now you're forced to go to the emergency room, or now you're saying you're too scared to go to the emergency room, but now I'm seeing you and maybe you don't survive that heart attack that you could have got that stent placed. Or maybe, you could have possibly just got that foot infection treated before it got to a point where it needed to be amputated. Or even those of us who need prostate cancer screening, breast cancer screening, sometimes it bothers me. And even as a Black physician, when they say, oh, Black people have the worst outcomes, they have poor outcomes. But it's like, is it because we're Black? Because they try to make that the narrative sometimes. Or is it because we don't have the appropriate access to healthcare? We don't have enough knowledge about what we need to be doing, and we aren't empowered to go do that. And so when we aren't having people talk to us about these things and we don't understand the importance of it, I'm all about trying to treat things at home. I'm all about drinking your tea and, doing whatever herb or something you want to do, eat your garlic, your onions. I'm all about doing all of that. But I think when something is wrong, we have to get it checked out, because if it happens, if we go too late, you rather be living than not living. And I think I see so many poor outcomes, and I see it. And just think about how it is. I'm rounding with a bunch of other doctors that maybe Middle Eastern, that maybe, Caucasian. And I'm seeing, we're looking at all of these different Black patients who may have died, who may be on full support, who may be on ventilators and all these things. And it hits me because I'm like, wow, these are my people that I keep seeing. And I don't know if it hits them the same as it hits me, but it hurts when I see it. When I have to keep seeing this recurrent, these poor outcomes back to back, it hurts. So I think we have to pay attention to that, especially if you don't know a healthcare professional, if you don't know somebody that you can be like, hey, I'm having this going on. Can you should go get it checked out. I would recommend going to get it checked out. But like I said, if you can, try and identify the places nearby that early on, so you don't end up in a crazy ER situation. But I think when it's that time, it's that time. And I think if you're having crushing heart attack, chest pain, sometimes you'll know. But unfortunately, in women, sometimes we don't know, and sometimes we diminish those feelings that we have because, oh, we get chest pain when we are stressed out anyway. So they blow it off. Oh, we get this, when I'm having a busy day anyway. But no, even if you have a primary care doctor, they can do a stress test. So even if you're not having a heart attack, they can see if you're already having some dysfunction in your heart muscle. So these are things that we can be on top of if we have a primary care doctor that can do it before now it's too late. And now I'm stuck and I'm having a heart attack and I'm trying to drive myself to the hospital, and maybe now it's too late.
Good advice. So just before I bring in Sister Sylvina, I just want to ask you, what advice would you, back to the second part of the question in regards to, would you recommend people pay for healthcare?
Yes, I forgot to answer that question. So I think I would say Of course, here in the United States, I think unfortunately that is you do have better access when you have health insurance. And so I think people should do what is in their means to do. There are different free clinics that are available for people who don't have health insurance. But I think if you have the means to do it, I do think you should have some level of health insurance, unless you just have money like that and you could just pay out of pocket for everything. Because healthcare, especially in the United States, is very important, where you're getting charged for each image that they do, each blood draw that they do. All of that stuff adds up. And so I do think it is beneficial to pay for good health care, because in this community, this society, that is unfortunately what we have here. But I do think that there are free healthcare clinics and people who are also trying to provide other services for people who don't have access and aren't able to, because not everybody has the means to, unfortunately. So although I say yes, because I do think in this day and time that does provide you with better healthcare, that provides you with better access when you pay for it. But I do understand that the reality of a lot of our people, a lot of our community, they don't have the money all the time to pay for it. But if there's a way, because there's even government insurance, even just Medicaid, if you find a way, just get some minimal type of insurance, so that way you're not in a situation where you don't have any coverage or anything. I'm not sure if it's the same in London, but I know for like here, for example, people can apply to just have Medicaid or certain, government insurance, health insurance, so that way they're not just out here without any health insurance or any means to not go to the doctors, because that is another reason why people don't present, because they don't have health insurance. So that is a lot of times why people don't go to the doctor, because they just don't have health insurance. So I think, like I said, I think you have understanding people's resources, but unfortunately we live in a day and time where you do have to pay for quality healthcare. But there are some doctors, like I said, in my hospital, they don't have the top dollars. We see a lot of people that are underinsured in our hospital or uninsured in our hospital. And so there are places that can see people that don't have insurance, but I do think you will have better quality when you're able to pay for it.
Particularly because we're going through, and I don't mean this necessarily needs to be perpetual, but because we're going through a time now where I think it's quite dicey inside some of these environments.
Yeah.
I think, affordability is such that, whoever's home I go in and don't find a pair of Jordans, then maybe if you got Jordans, maybe you need to reconsider your priorities. So, Sylvina, were there some questions you wanted to raise, or was there some questions in the chat that we need to address before we complete our wind down? Because
sorry, Karen.
Has shared so much with us.
Right.
Overload our audience.
No.
But are there any questions in the chat? And do you have any questions you would like to ask?
Everything in the chat has been covered. Everything in the chat has been covered as you were speaking, Sister Naa'irah. So thank you for that. I was just listening to you. To me, when you were speaking about psychosocial stressors, and that is it biopsychosocial, like a triangulation, right? I was thinking, so in what you said, you have like the external stressors that can lead to the things that you've discussed. But I was thinking, what are your views on internal stresses? For example, if someone's living, and they feel as though, because I'm thinking it's a question of contentment with life, right? So if a person's living and, they're not living the type of life that they feel like they have the right to live, or they're not reaching their full potential. So that's the person then putting internal stress, right? Because it's your thoughts, it's your feelings and your emotions.
I don't want to cut you off. I think I got disconnected. And so I think I missed probably the first part. I'm so sorry, but it got disconnected. Could you please tell me the question again? I'm sorry.
I thought that was a long grid. I thought okay. So, all right. So, you mentioned psychosocial stressors, and you mentioned that triangulation of biopsychosocial. And you quite eloquently spoke through, it seemed like the majority of things you discussed were external factors, external stressors. And I wanted you to comment on internal stresses, for example, because to me, when I'm listening to you, I'm thinking, well, you're really speaking about how a contentment that one has with life. So for example, if someone was not living their best life or felt like they're, not living a life that showcases their full potential, or, has missed out on opportunities or made bad. So this is internal. This is you, internalizing and having your own thoughts and putting stresses on yourself. I want you just to speak about that in terms of, does that feed into what the pedagogy that you're sharing this evening?
Yes, ma'am. So everything, yes, absolutely. Your internal stressors and internal conflicts and, different deadlines that you may have, or even what we call imposter syndrome sometimes. And when you feel like that you're not showing up the way you should. And, but, that's also interesting too, because when you think about that more, did that originate from an external stressor? Did you hear negative talk growing up? Were you in situations that warranted you to now question yourself and struggle with how you're showing up? So I think that is sometimes still linked to outside stressors as well too. I think they're all interconnected, but any type of stress, anything that your body perceives as a stress, whether internal, external, it will cause our body to release our stress hormones. And so I think, and that's why I mentioned that even having those mindfulness therapy, those social support groups to kind of help you deal with those internal conflicts, having an outlet for them, journal about it, having ways that you can address those so you're not constantly dealing with those internal conflicts. Because a lot of times, like I said, I do think that even those internal conflicts come from past external experiences. Maybe you were taught that you should be always on the go, go, go. And now you feel bad because you're not moving 24/7. Or maybe you were taught that you got to come home and show an A+ every single day, but now you're coming home with a B+. And now you have that internal conflict going on every single day because of something that may have happened in childhood. So I do think even those internal conflicts has a lot to do with a lot of the things that we hear, that we perceive, our work environment, the microaggressions, all of those things. So they're internal conflicts, but I do think they're very interconnected with our external experiences that make us have some of these thoughts and feelings and these internal conflicts and stressors. But overall, to answer your question, all of it is interconnected, and anything our body perceives as stress will cause our body to be in that inflammatory state.
So Dr. Naa'irah, how important is it then to shuffle the deck of our so-called friendships? Because sometimes people who we call friends, the only time, whenever you speak to them, they're dumping on you the pressures of their life, like as if you got them into debt, as if you messed up their relations, as if you got them fired. So all of these big stresses that people are suffering, in your so-called circle, how do you navigate that?
Brother Abdul Hakim, you're asking some amazing questions that need answers. These are things that are so important. I think that, number one, so although we need friends and social support groups, you should not feel like anybody's dumping grounds. And I think that, and even in certain situations, even with me, even recommending, hey, have you talked to anybody about that? Do you have a therapist? Have you done auditing? Because in our communities, we don't talk about that. We don't. It's such a stigma in our communities to say that something, and it's not even about you having a mental health disorder. No, people have anxiety. People have stress. People have depression. We have to realize that is a real thing. So now for me, especially since I started doing my own therapy, I ask people, have you done yours? Oh, okay. Like this may be something that you should talk about. Oh, have you tried journaling? And I think sometimes too, if you need to, disconnect, remove yourself from certain situations because you feel like that this is ultimately weighing on your spirit, we also have to be self-protective as well too. And I think that is another, that's very important. I'm glad you brought it up, because even in those social support groups, you shouldn't feel required to be somebody's dumping ground. You shouldn't feel like you have to take on that mental strain of somebody else. And I think but I think it's a area of opportunity for us to invite them to, like I said, to these other things like the therapies, the auditing, the journaling, the getting outside, and just doing other things. Because like I said, these conversations are just not being had enough in our communities. And we are just taught to just say, oh, we're good, we're fine. You know, there's this strong Black woman complex. We got it. We can figure it out. We don't need anybody. You're depressed. We don't talk about that. No, we need to talk about it, because I think that, like you mentioned, Brother Abdul Hakim, that is a lot the situation we deal with a lot of times, where people are calling you and they're trying to dump on you. You're like, hey, I'm good. I ain't trying to, you know, be brought down too. And you can still be a friend, but you don't have to feel like you have to be that only ear listening to them. So I think it's just an area of opportunity as well too. And just being self-protective, I think is important.
It was interesting. I was getting some keys cut in a store, and you know, I was having some light discussion with the lady who was selling me the key. She was on the front desk, and I just had her cracking up, you know, and she was like, you could tell she was having a stressful day. And then she said to me, you know, can you come back in every day? She said to me, can you come back in every day? I was like, wow, that is
You brightened up her day.
The fact that you can bring out a smile on someone's face who you don't know, and you got no ulterior motive, okay? And that resonates with them, and you lift their spirit. And you can see the woman just brighten up, you know, like brighten up. It's like, wow, we've got to learn. And even though I have my stresses, it didn't cause me to bring that into the store.
Right.
You know what I mean? I can park that, but some of us just can't get past front loading our personal issues and making sure everybody gets a taste of what I'm going through. Damn it. You know what I have to deal with? And don't care to.
And that's why it's so important. Like I said, it's so important. So for those who are doing the work and trying to heal themselves, trying to properly manage their stress levels, like we aren't only healing for ourselves, but even in healing ourselves, we heal in the community. Because like you said, you were able to talk and brighten up this person's day. And even we can, like I said, when we have certain things that work for us, and hey, I know that this helped me improve my stress level. This helped me show up better. Now we can teach the next person and recommend it to the next person so that they can hopefully implement some of these things in our lives. But it really is just it's just a testament to that we aren't really catering to doing the right self-care, and we aren't catering to our mental health like we should. That's really what it highlights in our community.
Right. So we've got 3 minutes, Dr. Naa'irah, and I thank you for your patience. Michelle, you had your hand up. Would you like to pose a question to Dr. Naa'irah?
Thank you. Assalamu alaikum. I have a question now. I know that this isn't like medical advice or anything, but I wanted to know, are there any fruits or herbs that are very good to like lower stress? Like magnesium's good for sleep, berries are good for brain health. Do you know of any fruits or vegetables, herbs that could lower our stress levels?
So that's a good question. I can't say that there's a particular food in mind that lowers stress levels. Like, for example, some people like drinking a glass of milk before bed because that makes them feel more relaxed, but that's not scientifically proven whatsoever. You know what I mean? This is just, but I think overall, I would say just trying to healthy eating in general improves your stress level. Because when you eat good, you feel good. So if you are eating the right foods, the proper foods, that I think alone will improve your level of stress. Because I know for me, when I eat something bad, I don't feel good about it personally. I'm like, oh God, I should not have eaten that today. And that does ultimately still lead to some stress levels that I may have. I don't have that this particular food is linked to lower stress levels. I can try to do more research and get back to you, but not off the top of my head. But I think overall, trying to eat healthier, if you are a proponent of fasting, all of those things I do think will help improve your stress levels, because I think they help you be more centered. It clears toxins out of your body, helps you think clearer. So I do think all of those things would be helpful and beneficial for managing your stress.
And don't you think, in addition to Brianna's question, Dr. Naa'irah, we need to get out more into the countryside, acclimate ourselves with nature.
Yes. Outside,
take our shoes off and walk on some grass.
Yes, get some vitamin D. That is what helps with stress levels. Vitamin D. Getting some sunlight, like you mentioned, getting fresh air, going for walks. Those are the things, exercise. Those are the things that are really going to help improve those stress levels dramatically. So yes, being one-to-one with nature, whatever that looks like for you. If you like the beach, if you like walking around outside in the grass, I do think that is very important for our stress levels.
Very good. Well, it's been a delight, Dr. Naa'irah. Very great. And, we were blessed to have you here in the UK earlier this year. And we look forward to receiving you back here. And obviously, next time you come, we're going to put you to work. In a non-stressful way.
Yes, praise be to Allah. We like that.
So those of you in the listening audience, if you've enjoyed this evening as much as I have enjoyed this evening, take your devices off of mute and show some love to our doctor.
I have really enjoyed hearing you.
Thank you so much, sister.
Thank you, sister.
Thank you, Dr. Naa'irah.
Thank you very much for your time.
Very much.
Great.
Thank you so much.
Thank you.
Welcome.
Fantastic.
Peace and blessings.
Fantastic. So I'm going to let Dr. Naa'irah.
Thank you.
Dr. Naa'irah, is there any closing words you would like to share just before you log off?
No, just thank you all so much. I appreciate you all having me on the program today. It's been a pleasure to speak with you all, and I hope that I shared something that resonated with you all and we can take back and implement in our day-to-day lives.
Do you enjoy our content? Well, make sure to like, subscribe, and click that notification bell so you won't miss an episode.